Imagine this, you wake up with chest pain and rush to the hospital, but instead of a human doctor, you're greeted by an AI system. It scans your body, checks your heartbeat, runs your blood work all within minutes. Then it calmly says you're at risk of a heart attack within 48 hours. Treatment begins now. No waiting, no human error, no hesitation. Sounds like a miracle, right? But here's the $1 million question. If machines can diagnose and treat us, what happens to doctors? Will artificial intelligence eventually replace them? Stay with me because this isn't just about medicine, it's about the future of human life itself. Artificial intelligence, or AI, has exploded across industries, finance, transportation, even art. But when it comes to medicine, the stakes are higher. Here, it's not about money or convenience, it's about life and death. Doctors spend a decade or more in training, learning anatomy, pathology, psychology, and most importantly, developing the compassion to guide patients through terrifying moments. And yet, AI systems can now analyze medical scans faster than radiologists, predict diseases before symptoms appear, and even assist in delicate surgeries. So, are we heading toward a world where doctors are obsolete, or will AI become their ultimate partner? Let's break this down. Part 1. The superpowers of AI in medicine. AI's biggest strength is speed and scale. Let's see where it's already transforming healthcare. 1. Medical imaging and diagnosis. Think of radiology. Every day, doctors analyze thousands of CT scans, X-rays, and MRIs. Fatigue sets in. Mistakes happen. But AI? It doesn't blink. Google's DeepMind has already built systems that detect breast cancer from mammograms with accuracy equal to or sometimes greater than expert radiologists. In ophthalmology, AI can identify diabetic retinopathy before a human AI notices it. Imagine billions of people worldwide getting access to faster, more accurate screenings, all thanks to algorithms. 2. Predictive medicine. Doctors usually react once symptoms appear, but AI flips the script. By analyzing massive data sets, blood tests, genetic markers, lifestyle patterns, AI can predict who is likely to develop heart disease, diabetes, or Alzheimer's years in advance. In one study, AI predicted kidney failure up to 48 hours earlier than doctors, giving hospitals precious time to intervene. That's not just useful, that's life-saving. 3. Robotic surgery. The Da Vinci surgical robot is already helping surgeons operate with microscopic precision. Smaller cuts, fewer complications, quicker recovery times. It's like giving a surgeon superhero powers, hands that don't tremble, eyes that zoom 1,000 times closer. 4. Everyday health assistance. AI isn't locked away in labs, it's in your pocket. Apple Watches detect irregular heart rhythms. Chatbots give medical advice at 2 a.m. Wearables track your sleep, stress, and oxygen levels, sometimes alerting you before even you feel sick. For remote villages with no doctors, this could be a revolution. So yes, AI is powerful, almost unstoppable, but before we declare the doctor dead, let's talk about its flaws. Part 2. The limits of AI. Because no matter how smart AI gets, there are cracks in the system. 1. No empathy, no human touch. Imagine a computer telling you, you have cancer. Would you want a cold printout or a human being looking into your eyes, holding your hand, saying, we'll fight this together? Healing isn't just science, it's trust, hope, compassion. AI can process data, but it can't wipe away a tear. 2. Data bias and errors. AI only knows what is trained on. If the data is biased, the output will be biased too. One example, an algorithm trained mostly on European patient data misdiagnosed diseases in African populations. Imagine the danger of a machine giving false results. Doctors can double check, but AI cannot doubt itself. 3. Privacy and ethical dilemmas. Who owns your medical data? Hospitals? Governments? Tech giants? And here's a scary thought. What if insurance companies use AI predictions to deny you coverage before you even get sick? This isn't science fiction. There are real ethical debates happening in 2025. 4. Human complexity. The human body doesn't always follow rules. Symptoms overlap, diseases evolve, and every patient is unique. A skilled doctor might notice a subtle sign, an unusual tone in a patient's voice, a faint detail in their history that no algorithm would pick up. AI sees numbers, humans see stories, and stories matter in medicine. So, can AI truly replace doctors? Not quite. But here's the twist. It doesn't need to. Part 3. The future. Partnership, not replacement. The future of medicine isn't man versus machine. It's man with machine. Think about it this way. AI is like a super intelligent assistant. It does the heavy lifting, scans images, crunches numbers, finding patterns, while doctors focus on what humans do best: decision making, empathy, and ethical judgment. Examples of collaboration. In radiology, AI flags suspicious scans, but the radiologist makes the final call. In oncology, AI suggests treatment combinations based on millions of case studies, but the doctor tailors the plan to the patient's unique needs. In surgery, AI robots provide precision, but the surgeon brings experience and adaptability. Doctors who embrace AI will thrive. They'll diagnose faster, treat smarter, and spend more time connecting with patients because machines handle the routine work. Doctors who resist AI, they risk being left behind. As one famous saying goes, AI won't replace doctors, but doctors who use AI will replace those who don't. And here's something exciting. In the future, your healthcare team might not just be one doctor, it might be human-AI duo, a partnership that combines the wisdom of experience with the power of technology. Part 4. A glimpse into 2035. Let's fast forward 10 years. You're in 2035. You wake up feeling unwell. Your smart home AI notices your elevated temperature, analyzes your voice for signs of respiratory illness, and books a virtual consultation before you even grab your coffee. During the call, an AI system reviews your genetic history, compares your symptoms with millions of cases worldwide, and instantly recommends treatment options. But here's the key. Your human doctor joins in, reviews the AI's suggestions, and then explains the plan with compassion and clarity. That's the future, not AI replacing doctors, but AI making healthcare faster, fairer, and more human than ever. So, will AI replace doctors? The answer is no, not now, not in the foreseeable future, but it will transform medicine forever. AI is not the doctor, AI is the doctor's most powerful ally. And the real winners? The patients, who will get care that is faster, more accurate, and more compassionate. Now it's your turn. Would you trust an AI system to diagnose you? Or do you think only a human doctor can truly heal? Let me know your thoughts in the comments. I'll be reading them all. And if this video got you thinking, hit that like button, subscribe for more explorations into the future of medicine, and ring the notification bell so you don't miss out. Until next time, stay curious, stay healthy, and keep learning.